Hey everyone, it's Dr. Gupta. We are going live with you today at the Dermatology Laser and Basin, Moksha Aesthetics, and we are going to be doing a Ultherapy procedure on one of our patients who would like to see a little bit of tightening and lifting, doesn't want to go through surgery. Ultherapy is awesome because you just have absolutely no recovery time at all after the procedure. It's a little bit uncomfortable during, but as you'll see, it's not terrible at all, and patients do very well through the procedure. We've also been doing it a long time, so I really understand exactly how deep to go and what transducers to use and how many pulses to make to keep it comfortable. But usually we can see a little bit of tightening right away, and then that continues for like 4 to 6 months even after the procedure, gradually getting better. I tell patients, don't be looking at the mirror like every single day at yourself, because then you kind of get used to your new body as you're morphing into a younger you. But if you look at photos, even a month out, patients really can tell a big difference. So that's really nice. So with the Ultherapy, it is using focused ultrasound energy that's traveling deep through the skin. And in this case, we're trying to target the SMAS. So SMAS is that tissue that normally gets sutured during a facelift when plastic surgeons do a facelift procedure. But in this case, we're able to get to the SMAS without having to cut open the skin at all. So it's really a nice advantage to rejuvenating the skin without surgery, without downtime, without scarring. And really nice results because it is so targeted. So compared to like the other skin tightening procedures we kind of call this the Lamborghini of all of our skin tightening, skin lifting procedures, because I think it is the best in terms of really focused targeting. The next best that I really like is called Morpheus 8, and that is a radiofrequency microneedling procedure where we put little needles actually get deployed under the skin, and we can choose the depth there as well. So I think that works pretty well too in terms of how deep we want that energy to specifically travel under the skin. And we can see some really nice tightening with that procedure as well. Both Ultherapy and the Morpheus 8 can also help a little bit with lipolysis or getting rid of some excess fat. Now, we don't always want to get rid of fat in somebody's face, but under the chin area, it's nice to get a little bit of slimming if someone has a bit of excess weight they're holding right in that area. But once we get to the cheeks, we change up the settings so we're not getting any lipolysis, and we're just getting the good skin tightening benefit, skin lifting benefit. So this patient also had another laser procedure just about a week ago where we used the laser to get rid of some sun damage, some brown spots and such, and they have risen to the surface and look a little bit darker and are still in the process of flaking. That's also very exciting, and besides it helping the brown spots and the sun damage go away, the skin also feels a lot smoother and silkier as a process, and I'm sure that our lovely patient here agrees with a nod, right, and a smile. Yeah. So she's actually doing pretty good. How would you say, is it really uncomfortable or not too bad? We're just making passes over the skin here, and then we're going to go across the cheek next. And then keep an eye on the screen, because that's really the key to this procedure, is what is showing up on the screen in terms of the image, because it actually spits an image in real time as to where the target energy is going to hit under the skin. And we are just in absolutely perfect position here. I can just feel it and sense it that she's going to get fantastic results. All of our Ultherapy patients get an improvement, which is really nice. I love the consistency of this procedure. It's a little bit lengthy, but usually we just get through talking about different things in life, or patients just kind of concentrate and meditate for a little bit. I don't think she's taking a nap, but she's not finding it terribly painful either. Patients do worry about discomfort from this procedure, and there is a little bit of discomfort, but it's not terrible at all. Awesome, so we're done with half the chin and half the cheeks here, and if I look from the top, I can actually already see some tightening, which is really awesome. You might be able to see it from that angle from below a little bit as well. This looks more defined and a little bit more lifted up already. Isn't that awesome? For those of you who are just joining us now, we're doing an Ultherapy procedure, which is a skin lifting procedure. It's actually the only procedure that has FDA approval for skin lifting versus skin tightening. So that's a really awesome indication. to have, and again, because it just so specifically is able to target the SMAS muscle for us. And then that's what I'm doing right now, is targeting SMAS. And then I'm going to go over the areas again to target more of the dermal collagen to get more of a rejuvenation and tightening of the skin itself. So this is what I call my foundation tightening procedure, foundation building. I like to start sort of with that deep layer, get the foundation really strong, and then we can do all sorts of procedures over that depending on what's needed, if there's sun damage, if there's volume loss, if one needs neurotoxins or whatever. But if your foundation is strong, then you can build a nice healthy home on top of it. And these are all ways to help us keep kind of resetting the clock and pushing it back so we can stay younger as we age, which inevitably we obviously can't stop the aging process, but we can definitely keep reversing the effects of aging, which is awesome. And the skin is like the only organ that we can really access so directly, so we can make a direct effect on rejuvenating this tissue very nicely. So that's our motto: look young, live young. It's all about feeling your best, looking your best, and living your life with confidence. Other procedures we do besides Ultherapy and Morpheus 8 for skin tightening include, if you want to get a little bit more aggressive, we can do a minimally invasive procedure called Face Tight or AccuTight, and that works really well too. It just involves using a local anesthetic under the skin and then using a little probe that glides under the skin to, again, tighten the SMAS, building collagen. That has a bit more recovery time. We can also get a little bit more lipolysis if you really want to get serious about killing the fat. Recovery time's not terrible. You have to wear a compression garment with that type of procedure for the first 48 hours, and then you wear it for another 2 weeks just in the evenings. So that's another option if you want to just get a little bit more aggressive on patients who have a bit more sagging and are a bit closer to needing a surgical facelift, and that's a great bridge procedure, that gap procedure for those patients. And then we have other non-invasive procedures too, using radio frequency. They can also work really well. We actually get some nice results with them. They're just not as targeted as the Ultherapy. So even though it's still heating the deep tissue under the skin, we don't have the visual of knowing exactly what tissue we're targeting like with Ultherapy. So we are done with our first pass, which was the deeper pass to affect be effectively tagging this mask. And now I'm going to come up a little more superficial to target dermal collagen. I can already see contouring. Both sides look more even now. Make sure we get a good image on the screen showing us exactly where we are. Getting the proper penetration of the ultrasound energy under the skin. How are you doing? Not too bad, right? Mm-hmm. Okay.
We have a couple new people tuning in. Do you want to explain what we're doing again?
Absolutely. So we are doing the Ultherapy procedure here, which is our favorite skin lifting procedure that is completely non-invasive, non-surgical, no cutting, no downtime, no stitches to worry about, and the only procedure that's actually FDA approved for skin lifting and not just skin tightening. So it does have that indication, and it is so targeted because it helps us to target the SMAS under the skin. Normally that's sutured when you have a facelift. So this is the closest we can get to a completely non-invasive kind of facelift with real results. It's really rare that an Ultherapy patient doesn't see a result. The degree of improvement can certainly vary, and that's something we can't control as much. But I'm telling you, most of our patients are extremely happy with the results of Ultherapy and can usually tell somewhat of an immediate difference. By a month, you can really start to notice it, and then it takes about 4 to 6 months to see the full effect from it. And the reason why it works so well is because it is showing us an image in real time of the tissues that we're targeting and where that energy is precisely being placed and going to. So there's very little collateral damage to the rest of the tissues in the skin, and we get all the good side effects, benefits, whatever you want to call it, that we're looking for. But this is a great way to keep yourself young, and even those patients who've had facelifts, we actually recommend doing Ultherapy every 3 to 5 years to keep reversing the aging process and to keep all the tissues tight. We're really fortunate with the skin as opposed to other organs that we can directly affect the skin physically. So that makes it easier to help us keep you looking young, because we want you to live young and enjoy your life and live your best life with confidence and not be, self-conscious about anything on your skin. A lot of times our energy level doesn't always match what we see in the mirror. So this helps to restore that confidence and youthfulness. But I love this procedure. It's a great foundation building procedure because we're really giving you essentially a facelift, but without all the cutting. And that restores the foundation under the skin, and then we can do whatever else needs to happen on top of that. There's other things that happen with aging or volume loss, and then sometimes we have to use neurotoxins because of movements that have become really prominent over time, and we just want to relax those muscles so they don't keep reinforcing certain wrinkles. We do that with neuromodulators, and then of course we have all the laser skin resurfacing procedures that help to take the surface skin damage away, like brown spots and facial vessels and scarring, like from acne or other sorts of wrinkling issues, whether it's fine lines and deep wrinkles, we can get rid of with certain resurfacing procedures. Ultherapy is not really a wrinkle treatment, it is more of a foundational skin tightening, skin lifting procedure. Not a lot of discomfort really. I think a lot of patients read about that. Ultherapy is painful. But as you can see, our patient is really comfortable here. There's, I'm sure, a little bit of discomfort, especially around the jawline, but overall really well tolerated. Would you agree? Just a nod? Yeah. But yeah, feel free to, if you have any questions at all, please write it in the comment section, and then Sophie can look at those and relay them to me, and I'm happy to answer any questions while I'm doing this for you guys. We can treat actually any part of the body with the Ultherapy. Of course, the most common area we treat is right here, the lower face, which is the cheeks and the chin. But we can also treat the under eye area, the forehead, lips, the neck, the chest does actually phenomenally well with Ultherapy, where it can help take away those etched in lines that happen as we age, and with sun exposure can really firm that up. You can get a little bit of a breast lift from it, and then we can also treat stomachs and arms. We've actually been having some phenomenal results with Ultherapy on tightening up the belly skin, and also the arms do extremely well with this type of approach, where it just starts getting kind of crepey looking and saggy. It can take care of that, again, with this completely non-invasive approach. So it is one of my favorite procedures. Of course, we have a lot of other treatments for those areas that can help too. Another great procedure is Morpheus 8, which is a fractional radiofrequency procedure that deploys needles at specific depths under the skin and then basically injects a dose of radiofrequency energy. And that also helps to rebuild that foundation under the skin and then build new collagen at the same time. So there's just like a little bit of redness afterwards and hardly any swelling from the Ultherapy at all. So patients can literally you can go to an event the evening of this procedure and it's really not a problem at all. There's no bruising, anything else you have to worry about. You can certainly wear makeup immediately after the procedure if you need to. We are seeing a lot more patients requesting all types of facial procedures right now during COVID because you have to wear a mask anyway, so you can hide some of the bruising if there is any, especially from filler. Sometimes we can see a little bit of bruising. Our patient here also had another skin rejuvenation procedure where we took off some brown spots and they're still in the process of flaking, so they've gotten a little bit darker and they're almost completely flaked off, but it's pretty impressive how much clearing we can get in just one treatment from the laser, wouldn't you agree? It's pretty impressive how much of that sun damage will go away. Now this procedure, the Ultherapy, does not work on wrinkles or surface sun damage. It is more of a deep procedure to restore the strength of the tissues underneath to give you that strong foundation. And we're almost done. We're actually making the last pass here, and then we'll do actually a little bit on her lip area as well. When she smiles, she's getting sort of a horizontal line going across the upper lip. So since we're doing the Ultherapy right now, it's not a bad idea to do that on the lip as well and achieve a little bit of tightening. But then we're also going to place a little bit of neurotoxin there just to help relax that movement a little bit, and a bit of filler to fill in the lines.
So Jessie Girl 75 wants to know what procedure this is.
This is the Ultherapy procedure, so it's called Ultherapy. The UL stands for ultrasound, and so it is a focused ultrasound, so it's called HIFU, H-I-F-U, which stands for High Intensity Focused Ultrasound. And so that's the kind of technology this is, where it's delivering a targeted amount of ultrasound energy to the tissue that we are trying to target. And we can do the targeting based on the depth that the transducer is penetrating. And it actually shows us on the screen during the procedure where that energy is actually going, so we know that we are actually right on the target tissue. And this is what you would call your non-surgical facelift. So this is your no recovery time, completely non-surgical, non-invasive way to lift your skin. And we can usually see a little bit of tightening right away, and we can certainly feel it. And then over the next 4 months or so, the skin continues to rejuvenate and respond to the technology and get tighter over time. We recommend repeating the procedure maybe every 3 to 5 years to keep everything firm. And that's true even for patients who've had a surgical facelift. You still have to do something to maintain it because the aging doesn't really stop, but we can keep reversing that and just keep resetting the clock for our patients. So we're really fortunate to have these procedures that help us stay young. And we can do it without going under the knife or risking general anesthesia or anything like that. Other procedures we do, just to kind of remind you again, so we have Morpheus 8, we also have the face tight and accu-tight procedures. Those are excellent also for giving us some tightening and lifting. With the Accutite and FaceTime type procedure, you just need a little bit of recovery time because there can be some swelling and it's minimally invasive. So you have to wear a little chin strap after the procedure for a few days. But again, very easy to get through. We might choose that kind of a procedure in someone who has a little bit more drooping and sagging and who might be closer to needing a surgical facelift. So that's a really good bridge procedure for those patients who are not quite ready to go under the knife but want some lifting and tightening. And the sooner you start on all of these procedures, the better, right? Because the sooner we can start resetting the clock, the better you age, and then you don't need as intense or dramatic of a procedure going down the road. It's really amazing, like in our patients where we have been doing fillers now for several years, if you look at the before photos and then compare them to how they look now, you will find that a lot of patients, well, the majority, all of them pretty much look younger now than they did before they even started coming to us 5 to 10 years ago. So just a really good testament to how much it really does help to invest in yourself a little bit, even if you can just do a little bit at a time. It makes a world of difference. And who among us doesn't want to age well, right? Want to look natural, but just age a little bit better. And this is a little bit more of a sensitive area because it's right by the nose. And sometimes it makes you want to tear up just a little bit. But it's just a few holes, so this is almost done. Okay. And that is it. We're actually done with the procedure. Call us if you have any questions at all. We'd love to answer any of your questions. Hope that was interesting to watch. I can already see an amazing tightening, and our lovely patient is going to continue to see more and more improvements over time. See you guys next time.